So we are meeting once again right here on the leading publication ZimGospel Masters, and we are meeting for the program Christian Conversations that we bring to you every Tuesday right here on the platform. My name is Marlvin Ngiza, Ambassador Mamifa. Thank you so much for choosing us. And today we are going to talk about accessibility and affordability of mental health services, accessibility and affordability of mental health services for young people. And in our today's episode in the studio, we are joined by a young people-led movement representative, and he's also the media and engagement officer. He is Ben. Thank you so much for coming and welcome live on ZimGospel Masters.
Thank you for having me. Very much delighted to be on the show.
Okay, so you can introduce which organization are you representing today?
Okay, so my name is Ben. I work with Young People Mental Health Trust, commonly known as Your Pet Health. We deal with young people mental health services, offering a lot of services from counseling services, support group sessions, and psychosocial education, both online and offline.
All right. So talking about working with young people, how is the experience? How is it like? Is it an easy thing as well as if you have to look at this issue of mental health?
I wouldn't call mental health on its own easy. It's broad, it's complex. We have a lot to do, and we still have a lot to go as a nation, considering the global standards and all. But it's been quite a journey. I started my advocacy journey in 2016, and to date I've gone to several workshops, seminars, and gained a lot of experience in the field. And the major challenge that I still see now that has always been there is the issue of access and affordability of all the services in regards to mental health as a goal, as a nation.
All right. And we know that there is something that triggers mental health challenges for one to seek these services. What are the major contributing factors to mental health challenges, especially among the youths?
There's a lot we can talk about when we talk about challenges in mental health, but maybe the general ones, they stem from the common drug and substance abuse problems. We have certain anxiety issues. We have a lot of issues that contribute maybe to the outlook and the output we see maybe when we talk about mental health. But maybe there's a general misconception when you talk about these cases where we view extreme cases maybe in regards to psychosis or monarupenka in Shona. But then there's a lot of underlying issues where we feel like we have to discuss. We have our depression, we have anxiety, we have a lot of stuff that really we don't talk about as individual or as a society. And those maybe they develop and grow and emanate and maybe exhibit themselves as very huge and complex cases. So maybe the general culture where we don't share, we don't talk, it stems from there, and the general environment we're surviving in, the economic hardships and the likes, they maybe sometimes act as triggers of these mental health issues.
All right, now that you have mentioned some of the triggers of mental health challenges among the youth, you as an organization, how are you now coming in and how exactly are you dealing with mental health challenges with the youth?
Okay, so Your Pet Health was established in around 2017. We formally registered in 2019. We've been working in Kweru, and we branched out to Harare in around 2020, 2023. And generally what we offer, the major backbone is our mental health revolution strategy, where we seek to provide information and attack stigma, so as to maybe to socialize and to normalize the concept of mental health. And so we have a lot of steps and a strategy towards this, which we stick to and adhere to when we work with young people. And to date, we have worked with several schools with approval of the Ministry of Health. So we have a DAS program, which we call the Drug and Substance Abuse in Primary Schools, which we launched in Chikumbiro schools in Kweru. And this has been a success. We've worked with the American Pediatrics Association in partnership on that project. So what we do, we provide psychosocial education to both teachers and students, so as to tackle the concept of mental health, to normalize it, addressing stigma as well. And we also have online platforms and forums where we talk about these issues to do with mental health. We have an open WhatsApp psychosocial class, covering a lot of topics. It's been running for about 3 years now. So it's there. We have a lot of membership. It's ongoing. We talk about different topics in line with the trends, in line with maybe the concerns. Sometimes we get feedback from our audiences of the topics they want us to talk about, and we take time to research and address this topic. We also have peer-to-peer support groups here in Harare, and these have been very helpful. We launched this in 2020, and we have seen a lot of people coming in, and we have had a lot of sessions where we have safe spaces where people can come in and discuss several mental health issues in line with like a lot of issues that they're going through. Generally, that's what we do.
That's awesome. This is Christian Conversations live on ZimGospel Masters. Today talking about accessibility and affordability of mental health care services for young people. And we know that you are working with young people with regards to these issues in particular today. And there are some levels that you may reach, and sometimes there are scenarios where you need now to approach services, where you now need to seek assistance from medical institutions maybe. Tell us about the accessibility of mental health care services in the country. Where are we now?
To sum it up, maybe the long and short of it would be we still have a long way to go as a nation. And right now we're seeing the effects of COVID-19 with a spike in drug and substance abuse, with a spike in globally as well in various mental health issues. So really we still have this spike has created and exposed the shortage we have maybe in skills, particularly in research and material when we talk about mental health services as a nation. But we're very much appreciative of various government efforts that have been coming in support with this cause. We've seen the initiative to clamp down maybe the address on drug and substance abuse. It's been like the campaign has been very successful. We've seen a lot of talk around mental health. We've seen it going ahead, but still there's still that lack that is there in terms of skill, in terms of research, and in terms of facilities as a whole. Like if we check the statistics at our local institutions, if you check at Annex, if you check at several halfway homes, and even Gomauru and other regional and local institutions, we still have a long way to go. And we're calling it collaborating effort, collaborative support in addressing this issue of mental health issues. But then as an organization, we're graced to have several approved and accredited psychologists on board who provide services sometimes for free, and sometimes we bring them in our exhibits, and they come in, they provide the services. But still it's not enough. We still have a lot to do, and we're calling it for a collaborative efforts on all major stakeholders, all major players in this mental health field to come in and map a way forward as we go ahead and tackle this issue.
All right, you are talking something that is very important when it comes to accessibility, and you're saying that it now needs collaborative efforts of all stakeholders to ensure that accessibility is scaled up in the nation. Let's talk about, in the case that these services are available, are accessible, what about the issue of affordability?
Now that's a different topic altogether, I would say. But maybe the issue with mental health, its most devastating effects, we see them in most vulnerable and poor communities. And most of these communities and members in these communities, they really don't have much funding and maybe support to tackle these issues. So in as much as we would want to maybe to take a global stance and collaborative stance in attacking this issue, we still have this issue of cost and fee involved. But then maybe we are pushing for maybe an incentivized or maybe a system where these services are made accessible even to poorer communities. But then at the moment, there isn't much to talk about because it's still a struggle. Even if you maybe you are up there, we still have these cases of mental health issues, stress, your depression, your bipolar, because it's still a sensitive area and topic to talk about. So yes, in as much as we want to make the service available and affordable, the critical issue is to make them maybe accessible to everyone. regardless of status, regardless of maybe income involved. And you have these approaches and techniques, maybe implementations that deal with poorer communities, but in particular.
All right, that's awesome. 0714810907, that's your WhatsApp platform, talking about accessibility of mental health care services. Now, we know that today you've come representing the young people. You are the voice today, and you've got the desire and your strong wish when it comes to issues around accessibility, issues around your issues of mental health are looked at and are addressed in communities and in the nation at large. What's your strong wish, what's your desire, and what's your core as well with regards to accessibility?
I think that the most critical core now is to have maybe let's take time to understand the concept of mental health in general. Because in a society where we live in, there's a lot of misinformation that's circling around, and with the society and culture issues involved, we understand that the concept of upenga in general can be regarded as maybe a case, or there's this general feel like there's a lot of spirituality, understanding this is a gospel channel as well. So now it's a very, like, we need to take time and understand these issues. And what I can say, it's not a matter of choice in most cases. It's not a matter of control. These people have problems, just as we can have a headache, just as we can have maybe something wrong with our physicality. That's what happens even in our brains, and then we see the manifestation of these effects through various mental health issues. But then we have to actually take time to understand this, address the stigma, so that we can approach these young people with maybe a sense of care and a sense of love. I understand even when you talk about issues to do with drug and substance abuse, there's an issue where you can just stop, but sometimes it's really not an issue of choice. They need help. They need these facilities to come in and address and maybe and help them get to their sane minds in some cases, and get that proper treatment for them to actually come back and be rehabilitated back into the society. So it's a burden on us as a society to actually go out and look for information regarding this issue of mental health on its own, particularly with the youth, even in various age groups as well, and support, because they need our help. We are the only lifeline they have, and we really can't do much by just offering care, by just offering support. And maybe to the general public, no matter what you're going through, take time to actually talk to someone. Take time to actually address whatever you're going through, because these little problems and these little issues that actually grow and become bigger. So whatever you're going through, find someone you can talk to, find someone you can share with, because we've seen a rise in cases with suicide, we've seen a rise in cases to do with drugs and substance abuse and stress and depression. But it's just talking to someone really helps. It's very much important that we take time as a society, to take time as people, as men, as women, to just sit down and talk about stuff. The more we do that, the more we can actually address the concept of mental health in general.
That's very true. Strongly understanding that unattended mental health challenges pose a huge threat to our mental health as young people. And one might not be aware that seeking a professional or seeking mental health care services is very critical as a young person. What's your word to young people with regard to seeking mental health care services?
As young people, we're saying that there's a lot of organizations that are offering these services. Most of them are for free. Notable is you can look us online, your Better Health on Facebook is there, you can look us up, you can reach out, we can help. We have these peer-to-peer services that we offer. We can just talk to you, we can provide you with the proper help that you need in most cases. So the help is there. It's actually upon young people to actually seek out and maybe cry out for this help, because there's a lot of organizations at the moment that are actually working towards providing these services. So in as much as it might feel that people are in a bubble or people are operating maybe not really, there isn't much that's been done, we're seeing collaborating effort. We're not there yet, but there's something that's been done. So it's upon people to actually go out and look out for maybe these services, mostly youth focused services. They are there, they are available. And if they look out and if they can get help on these maybe smaller issues, then just maybe we can stop them to developing to be maybe major and bigger issues as well. So seek out for help. It may feel like a burden, but do seek out. And in most cases, maybe it may feel like you're trapped. Just maybe start with the local circle that you have.
Okay.
We have the parents, we have the guardians, we have the teachers. Just someone you're free and open to. You can start from there, and then they can refer you to a better service. I think that's what I have to say towards young people.
Well said. And your contact details as an organization, how can people get in touch with you if you are comfortable to share? And of course, your social media platforms, and if you have got some physical address where young people can reach out. We know that mental health is really a subject that we need to talk about. Do you have something like that?
Okay, so for our contact address, you can just WhatsApp this number. You can talk to Tawanda, you can refer you to some of our services and our groups. It's 0783 232 788. 0783 232 788. And you can look us up on Facebook with it's Your Pet Health or Young People Mental Health Trust. We're also available on Twitter, Instagram is the same, Young People Mental Health Trust. You can come in, reach out. We have a lot of exciting events, we have a lot of exciting programs that we do as well as an organization that are centered and focused for the youth. We also have sporting facilities coming in. We have a lot of new things coming in to try and get people involved and gathered around the issue of mental health. And I'll take this opportunity to say that we have a mental health expo coming in shortly, just next month. We will be conducting one of our most proudest event of the year. It's our mental health expo, where we bring in people from different faculties, different walks of life. They share their stories, they get to understand the concept of mental health. I think it will be at a sports club as well, just like the last time. It's called Patandaro. You can come in to Tandara in the literal sense and talk about these mental health services. Okay. And please do take time to get into our peer-to-peer support groups. We have this every month. So every month we pick a topic, we sit, we discuss. Okay. And these guys are guided by trained and accredited professionals. Wow. So it's really important for us to just sit down and talk. Okay. We have the services available for the youth. Thank you.
That's very awesome. Acknowledging some of the efforts that have so far been made by stakeholders towards ensuring access in affordable mental health care services. That's the Young People Mental Health Trust calling for collective efforts towards ensuring that these services are affordable, are also accessible. And to all the young people, it has been urged and encouraged that please share your issues, seek medical attention, seek also mental health care services so that you do not get your mental health extremely affected. And we need to work together to challenge stigmatization as well as to challenge misconceptions around mental health challenges. My name is Marlvin Ngiza. Until we meet right here on the platform, subscribe on our YouTube channel, that's ZimGospel Masters TV. You can also get the latest news on our website, that's www.zimgospelmasters.co.zw, as well as on Facebook, that's ZimGospel Masters Official. Let me take this opportunity to thank Media and Engagement Officer, that's Ben Rupondo from Young People Mental Health Trust, who has just joined us for our today's episode of Christian Conversation, in which we are talking about accessibility and affordability of mental health care services. It's a goodbye for now.